I-29, the free spot, G46, and O66.
I might be able to win something.
Yeah! Congratulations. Anyone else?
Oh, B1.
B1.
This was January 24th. January 2002. That's
We can remember September 16th is Ohana Walk, know your friends and family.
Bingo! I heard multiple bingos, right?
Yeah.
And we're ending the game first number.
What you got there, Buck? So many prizes.
Okay, visit accsb.org. Bingo. All right.
All right, Lydia. Hello. All right, Rick.
Oh, yeah. My
Let's take a
That one.
O69.
Thank you.
Last winner, okay, guys, so good luck. Hope you I-28, the first spot, G50.
To get a quick history of the cyanotype photographic printing process.
I'll do these little ones this time.
How many people are ready to go outside?
a few more seconds, please.
Okay, we'll give you a couple more minutes.
Thank you. Okay. I got the timer. Oh, no shadow.
No, you can keep it on because it will be shadow.
Just brought some jewelry. One, I did have the pair of earrings that I could use.
Yeah, I just brought in some odds and ends like paper clips, silver and red color, and I used a key and a penny.
You can stick somebody's face on it. And then
Middle is not storage.
put it on the drying place.
I'm saying
Like more like a
multimedia.
three-dimensional.
Multimedia.
Some other thing to it.
Yeah, you could.
So it's not just blue and white color.
Yeah, you could do like a three-dimensional thing.
Anybody got a timer on this time?
Hello everyone, and welcome to our presentation that is our second episode in this series of cancer awareness and early detection. And if any of you had seen our first episode, which was back in June, we had many nice comments about our format, and so we wanted to stay with this same type of presentation for today. My name is John Hada. I'm a retired gastroenterologist. I practiced here in Sacramento for 40 years, and my practice was in South Sacramento. So I've seen my share of GI malignancies, but today we're going to continue with our speakers to share with us their own experiences dealing with cancer. In the future, we plan possibly on a quarterly basis to have after diagnosis, treatment modalities, and also after treatment experiences that some of our participants have had. I'd like to give a short disclaimer regarding the sensitivity of some of the information that you'll hear today. Our participants have all been kind enough to share their experiences, but we also want to make sure that we keep confidentiality as best as we can. We also want to remind all of our viewers that any information that you hear today should also be passed through your own primary physician, and they can also give you more advice in regards to some of these different type of tumors and cancers and further treatment and diagnostic modalities. I'm going to start with introducing our participants today, and they will be giving their own personal history as well as their connection with ACC and with the community here in Sacramento. So I'd like to start with Brian Chin, and he will start the introductions.
Just a point of clarification, John, are we going to go through introductions first and then we go back and share our story?
Yes, just introductions.
Okay.
Short introductions, and then we'll share our stories after that.
All right. Well, good afternoon. Again, my name is Brian Chin. I've been with ACC and Meals on Wheels for many years. Currently, I am the president of the board of directors for Meals on Wheels by ACC, and I've been involved with Meals on Wheels since its beginning within the ACC umbrella, and that goes back to July of 2010. Prior to that, I served on the ACC board of directors, and I was also had the pleasure of being the board president for 3 years there. I've been involved with ACC for many, many years, and goes back to before the bingo days, of which we had 20 successful years of doing and having fun with. Thank you.
Thank you.
Good afternoon, everyone. My name is Esther Hokama, and I'm a retired registered nurse. And I've been a volunteer for ACC for many years, doing bingo and other classes. So
I have a special connection with Esther, and when I first finished medical school, I moved here to Sacramento to the county hospital, and Esther was one of the first kind faces that I met up on the floor, and she was a head nurse of one of the medical floors, and she was my go-to person when I needed to find out what to do during certain emergencies. But I appreciate Esther's help over all these years.
Thank you, John.
Hi, my name's Titus Toyama. I've been involved with ACC, like Brian, going back to the bingo days at Mayhew Bingo Center. And over the years, I've enjoyed doing various activities here at ACC. And most recently, I've been taking Japanese, and I was participating in the senior escort program. And I also serve on the board at ACC. I'm the treasurer of the organization. And so I get involved with many different aspects of the organization, and I'm here to share my experience with cancer.
Hi, my name is Donna Komare Toyama, and I'm married to Titus. I'm here to add a family member's perspective of cancer. My background with ACC started in the 1980s, early 1980s. Titus and I were newlyweds, new to this Sacramento community, and we found this wonderful group of people through the ACC bingo experience, where we were on the floor selling papers and calling out the winning bingo numbers. So a lot of good memories of friendships that were formed, and over the years we remain committed to ACC's mission and also just their visions for future programs and facilities. We well, for myself personally, I've taken many classes at ACC, and then just try to be supportive of Titus, who goes to a lot of ACC meetings.
Thank you. We will now move on into the personal experiences of each of our participants. Brian Chin has described himself to the rest of us as a, quotes, typical patient. And what did you mean by that when you thought that you were a typical patient?
Well, my journey with detection of prostate cancer is a long one. It started back in, I think, in the early years of this century. It started when I went in to see my primary care doctor just for my routine health exam, but I did comment that, you know, I'm going to the restroom quite a bit. Upon that, the doctor decided to give me the good old digital exam, and gentlemen, I think you know what that means. She felt some irregularities, so she referred me to urologist. I'm with Kaiser. So the urologist checked me out and told me to take a PSA blood test. He also gave me the digital exam, and the numbers were, you know, low, meaning below 5. And he gave me a biopsy. At that time, fortunately, we found nothing. So the instructions were come back every year for the PSA test. So this went on for quite a few years, and the numbers were still pretty good, still below 5, and he said, okay, we'll just keep this up. So there, we went from 2002 to approximately 2018, where another urologist called me up, his office called me up, and he says, I am replacing your first urologist because he is retiring. So this urologist is a young guy, and he said, come on in, and he examined me, looked at the numbers, and the numbers were starting to go up into the low teens.
Are you talking about
the PSA test numbers? In addition, he this is where we take a detour from from prostate cancer. He gave me a I never can pronounce this.
Cystoscopy.
Cystoscopy, and where it's a very uncomfortable examination, but he observed that there were some apparent small tumors on my bladder. So he said, let's pay some attention to this. And he felt confident that there were tumors, so he ordered a TURB, which is a minor procedure where they scrape tissues off of your bladder. This is all, I'm asleep. I don't feel anything. And he came back and said, yes, you have bladder cancer. Fortunately, it was stage 1. So we spent a year addressing the tumors. I had a couple more surgeries, and I took immunotherapy, a drug called BCG, and that took care of the cancer. But that took a year out of the examination and attention to possible prostate cancer. And fortunately or unfortunately, it was the first year of COVID. So yeah, I had fun going to the hospital, several times that year. But in the end of 2020, he said, you're cured of bladder cancer. So let's now pay attention to possible prostate cancer. So we had a biopsy. The results were not good for me. And so we went through months of scanning, and we talked about possible treatment. We considered radiation. I consulted with a radiologist, and we both came to the same conclusion that the best course of treatment for me would be surgery to remove the prostate. So I have this habit of getting surgeries on holidays. My bladder surgery took place on the day before New Year's Eve, 2019. And so, yeah, it's really fun hearing the nurses say, Happy New Year in the middle of the night when you can't sleep. My follow-up surgery happened on Valentine's Day. And the doctor recommended a third cleanup surgery, and he proposed September 15th, my birthday. I said, no, we're not doing this. So we took care of it the following week. So my prostate surgery took place on a Sunday, D-Day. So so I had my prostate removed. That was in the year 2021, D-Day. And to this day, I have not had any significant detection of cancer through the PSA tests. Unfortunately, a byproduct, a side effect of having your prostate removed is that you're incontinent. And so, I've learned how to shop for Depends. And the best price is at Costco. So here I am today, still free from cancer, but still 2+ years later, still incontinent. But the key to this was that my detection took many, many years because prostate cancer typically is that it's slow growing. And they often say, if you're detected in the later years, like in your 70s, if it's a slow growing type, the discussion is, should we just let it ride, because probability as a man of that age could pass away before the cancer gets you. Unfortunately, my biopsy came back and says, you have stage 2, and it's the aggressive form. So that's why we took quick action. But fortunately, it was still stage 2, not stage 4. which is basically, make sure your papers are in order, approach life. So that's my story.
Thank you. I think the important points of Brian's story is that he continued with his follow-up over a total of 18 years, I think you said?
Something like that, yes.
And his cancer was detected when he was in his mid-50s. And usually at that age, prostate cancer is not as common, or if it is picked up at that early stage, it's usually a very good prognosis for treatment and recovery. So we'd like to commend Brian for continuing with all of these treatments and multiple surgeries and not losing his focus to get all of these things done which had to be done. And we wish that he has continued good reports from his physicians. Okay. Next, we're going to move to Esther Hokama. And Esther has had an experience with breast cancer, and she'll give us her story.
Okay. I had my physical on March of 2019, and I had my mammogram, and I went into the radiology department and had my mammogram done, and the radiologist called me into her office, and she pointed out the site of my mammogram that there was a little spot on my right breast, and she said recommended do a biopsy. So the doctor, my surgeon, did the biopsy, and she told me that it had not spread anywhere, any of the tissues. It was just what she called it was ductus carcinoma in situ, which did not spread anywhere else, but it was in that certain spot in my right breast. So she recommended lumpectomy, which I did have lumpectomy. And after my surgery site healed, I saw my oncologist, and he said, I recommend radiation, but no chemo. And he said, you'll be having radiation 4 weeks, 5 days a week. But he said, you could just continue what you were doing before you got the diagnosis. And so since my lumpectomy has healed, I started my original thing that I used to do, which was going to the YMCA, swimming at least 3 times a week. And after that, I would go to the radiologist and have my radiation. And after radiation, then I would go to my ukulele practice with Glenn and Apakapakas.
ACC.
So that kept me up. And after I finished my radiation, he recommended taking tamoxifen for 5 years. And I've been taking it for 4 years. Next year, 2024, will be my 5th year of tamoxifen. So hopefully, all my mammogram up to now has been negative since the surgery. And I hope to stay that way. But I recommend that you do your regular breast examination, have regular mammogram, and also when you do go to the doctor, make a list of what you want to ask, because a lot of times when you go to the doctor, you kind of forget, and then when you get home, I say, oh, I should have asked him that. But so that's what I do. I make a list before I go to the doctor. And let's see. So I'm I'm still doing my thing, swimming and playing my ukulele and enjoying my life. Thank you.
So Esther, were you following all of the guidelines for mammography that as best you could? And when did you start getting your yearly mammograms?
I've been doing it every year with my doctor.
Starting at what age?
Gee, I must have been, God, I can't remember because it's been every year. So I think it must have been my 30s, I'm not sure. 30s or 40s, I'm not sure.
Thank you.
I can't remember. But it's been every year I have been getting mammogram.
Presently, the guidelines from American Cancer Society recommend starting at age 45, but for persons at higher risk with family history or with any genetic mutations and so forth, they recommend starting at age 40. So it seems to be a little confusing on some of these guidelines from the radiologists to how often you should get them. But were you told to continue every 2 years after that?
No, I was getting every year.
Every year from
Even
now
now,
on.
after the lumpectomy, he said, recommend every year.
All right. Thank you.
Which I have been, yeah.
Did you have any other risk factors, family history?
No, I had no family risk factor. And, yeah, no.
One of the other, some of the other things they mentioned regarding risk factors include physical inactivity, but as Esther has shared with us, she's active in swimming and playing ukulele and going out and so forth. Also, other risk factors are hormone replacement therapy if you're taking estrogen and so forth. That can increase your risk.
Right.
But she was not doing that.
So I'll be finished next year. That'll be my 5th year.
Of the tamoxifen.
Yeah.
Right. Tamoxifen is a estrogen receptor blocker, and certain types of breast tumors are more responsive to tamoxifen if they have this estrogen receptor, and usually holds a better prognosis as well. Okay, thank you. All right, next we're going to hear from Titus and Donna, and maybe Titus, you want to give your story first, and then Donna can explain why she's here.
Okay. So like Brian, I'm a prostate cancer survivor. I'd known for many years that I might get cancer because my mother is a breast cancer survivor, and I've had aunts and uncles and cousins who had cancer, including several cousins who actually died of it. So in the back of my mind, I always knew that I had a higher risk of getting cancer. And so back in about 6 years ago, my doctor was recommending I take a PSA or do another PSA test. And the significance was that my PSA was not really high, but it was increasing rather quickly. At that time also I was changing doctors. And then when I saw my new doctor, she noted my high PSA score. And she herself had a father. Her father had prostate cancer. And so based on that, she recommended very highly that I see a urologist. And so I went to Sutter, met with a specialist, and gave him my family history. And what stood out, again, was the family history of having cancer. And so even though my numbers were moderate, he still recommended that I do a biopsy. And so I did that, and it was a bit more painful than I thought it would be, but I powered through it. And it turned out that, in fact, I had 30% of my prostate was infected by cancer. And so he recommended that I think about treatment radiation or surgery. And after considering a whole lot of factors like my health, my age, and so on, I decided to have surgery. I also decided on surgery because I learned that the surgery is done robotically, and there's just a few holes left in my stomach, but it was having it done robotically made for fewer side effects. So this wasn't like prostate cancer of 30 years ago, where it's much more invasive. So I readily chose surgery. Another factor too, frankly, is that, okay, I saw the surgeon, I saw a radiologist, and after seeing the radiologist, I was good to go with radiology. But then I saw my surgeon again, and he had the last word, and he was a very competent surgeon, so I went with the surgery. Another factor was, over the years, I've been trying to keep my health up, and he said that given my otherwise good health, I would do pretty well with surgery. So back in October of 2017, it wasn't a special day, Brian, it was just a regular day. I went in the morning, they put me under, and they took out my prostate, and I was gone the next day. Relatively painless. In the surgeon's words, my operation was uneventful. He didn't say it was good or bad, he said it was uneventful. And so I was good with that. But one thing about the surgery was, the after effect was I had to get used to having a catheter put in because, as Brian mentioned, it affects your bladder control. And so it took me a while to get used to that. But within 6 weeks, I was back up and walking around and exercising and trying to get back to normal. And in fact, what I did to help me process and my own recovery, I kept a journal, and I found it this morning, and of how I felt in certain days, and more significantly, how many pads I was using every day. And then when I saw that number coming down from 4 to like 2 to 1, I felt I'm on the road to recovery. So within, I would say, a couple months, I was pretty much back to normal. But one thing I wanted to share with the group was not so much how it affected me, but how it affected my family. For me, I was almost dispassionate about my treatment because I read the numbers, I kind of knew what was going on. I did not have an issue with having cancer because my family members had it. But for my wife and also my daughters, it was different. You know, for the daughters, their exposure to cancer was seeing their friends' parents die of it. And so I can imagine them thinking, well, how long does my dad have to live? Without understanding how cancers are different. And fortunately for me, it was prostate cancer, which is very common among men, but as Brian mentioned, people don't necessarily die of it. It's very manageable. And also, I was supported by folks in my community, my church, and so on, who also had prostate cancer. And hearing their stories and hearing how well they're doing made me more confident that I'll get through this. But I wasn't sharing that with my loved ones. They were really afraid for me. And looking back, that was probably one thing I regret not doing, was involving them more in terms of what I was going through and letting them help me. One example of that is that on the day of my surgery, my younger daughter, she really wanted to be there with me, to be there to support me, to kind of go through it with me. I said, no, Katie, go to work, have a good day, I'll be fine, without realizing that she wanted to be there with me. And another thing too with Caitlin is that we decided, frankly, not to tell her about my prostate issue because she was studying for the bar exam. And I didn't want her to be distracted by my surgery because I wanted her more than me being better, I wanted her to pass the bar exam. And she told me a couple weeks ago that she was upset that I didn't tell her in advance what I was going through. So, you know, for me, the experience was not just about the process of the treatment and the diagnosis, but learning more, appreciating more how much, you know, your folks, your relatives care about you. And in fact, I like to joke that after my surgery, I had never gotten so many get well cards. So I felt that love and support, and I probably should have realized that more in advance earlier. And then talking to Donna about today's presentation, I think she has some perspectives on how it was to be a loved one of a cancer survivor, and how in some ways I made it difficult, but by sharing this story in the future, I hope that other patients would be more cognizant of how you don't go through this alone. No matter what you want to do, they're going to be there with you, and that it's something that you should really appreciate and take seriously and be thankful for.
Well, I have to say first the disclaimer. I wish I could offer a lot of insightful words and information, but I have to be honest and say that when Titus first told me that he was going to the doctor, the possibility of prostate cancer, my first reaction was just shock, disbelief, and fear. So when I think back during that time, there's a large gap of memory. I think that just the shock of it, it really affected my processing, my ability to process information. And I had to just quickly shake myself and say, you can deal with the emotions later, but right now, you just got to be on point and just be ready to support Titus in any way that I could. So the shock and the disbelief about the cancer, Titus mentioned that there is a history of cancer on his mother's side of the family, but despite knowing that, and I mean, we both went through Mom having cancer, but despite that, I'm married to a man who is athletic. He runs marathons. He goes to the gym like 5 times a week. He watches his diet. He has a healthy perspective about life. And so it was just total shock. Like, wait a minute, he's doing everything right. So how could this possibly be? And so I think my brain was just trying to catch up to the emotions. And it finally just had to stop and say, I can't make sense of this, and let's just go into support mode, because that's what is needed right now. And so we made a decision early on that I would attend all of the doctor's appointments, and that both of us, we tend to like to be over-prepared for things. And so he would have his questions, I would have my questions written out, and we would just back each other up. If the doctor answered a question and we didn't understand or felt like too much medical lingo, I didn't quite get what he was trying to say, we would stop and just ask questions. And I think that really helped, having 2 people asking questions. So while the doctor's answering one question, you're thinking about the next question or the follow-up question. But I think that was one way I tried to show support, was to really engage with those doctor appointments and to not be hesitant about asking those follow-up questions, because I really wanted to understand. The whole thing about the numbers with prostate cancer, I think I'm still kind of trying to understand that. But yeah, trying to understand the tests and what the numbers mean and the prognosis. So what was reassuring was finding out that early detection, it really makes a difference in this type of cancer, and that because of that and a healthy lifestyle, it was all very positive what the doctors were saying in terms of prognosis. So that kind of helped to get me a little more out of the fear side. But I don't know when the shock and the disbelief, if ever it left. It was always kind of hovering in the background, like this couldn't really be happening, but it is happening. And then I think the other thing that just really made a tremendous impact on both of us was, again, like Titus said, the support. If not for the support of people who shared their own experiences, we have a person in the room who would stand up in church and just tell men to get themselves tested. I mean, and also just sharing about his own personal experiences, things like that. You think, oh, you know, that shouldn't make a difference, but it does. Sharing information, sharing stories, and just the care. Our minister is also here in the audience, and I just have to repeat something that she wrote recently in an email as we're trying to support some other church family members. And she said, listen, love, and pray. And I think that is so important. It's trying to show your support for whether it's an immediate family member or a friend or a co-worker. Those are the things that you need to do is first listen, because they'll tell you just whether they're ready for visitors, whether they're ready for any kind of help, and then to respond in love, because they may not get back to your emails for weeks. And it's not to be taken personally, like, how come they're not responding to my email? But they need to be given space and to be given some grace to make their own decisions and go their own path, because everybody processes information and what their experiences are differently. So as people who are trying to be supportive and loving, sometimes we have to step back and just let them make the decisions and just really listen to them, and listen to them sometimes in silence, because we need to just give them that space to just express whatever is on their minds and whatever they're feeling. And sometimes that just means listening. So I feel like I have a lot of good teachers out there that have helped us through this. And so if anything that I can share, it's there's shock, disbelief, and fear, and you talk to your loved ones about that. And I will have to also say to Titus, you know, that he felt that we should have shared more with particularly Caitlin. And now that we're past it, I agree with you about that. But we were both thinking that we were protecting her so she could just focus on passing the bar exam and not being distracted by her dad's illness. But I was telling Titus that I recall several years ago when I was in my 20s, and I was living in Alaska, and so I was very far from home, California. And I didn't realize or know that my mother was going through some heart issues. And then the way I found out was I received a letter from my aunt, my mother's sister, and its first line was, "We really hope your mother's going to make it." And I thought, what is going on? And jumped up and called her on the phone. And the first thing my mother said is, "Oh, I'm just fine. People are treating me like a princess." And I thought, Mom, you didn't tell me. So I should have known, but you think you're protecting the person, but they're involved in it too. So it's good to have them also involved in it. So yeah, that's one thing that I think we both learned with Caitlin. Felt terrible about it later when she's saying, I wish you would have told me. Mm-hmm. And that story of what I had gone through with my mother came back to me, and I thought, oh gosh, I thought I would never do that to my children, and yet I did.
I mean, there was one moment when I realized that I had to be more aware of Donna's feelings. It was after I was told by the doctor that I had prostate cancer, and we had driven separately, but Donna, being who she is, she stopped at Marie's Donuts to buy my favorite donut, a maple bar, to make me feel better. But turns out she saw some friends of ours at Marie's Donuts, and Donna broke down.
Yeah. I surprised myself too about that, because I thought I was totally in control, that we were working on this together, and we had lots of information that was very positive, and so I was okay. But talking to this, maybe because it was totally unexpected, running to these two friends, and I'm just telling them, oh yeah, about Titus, and I just broke down and cried. And I just thought, wow, where'd that come from? I thought I was totally in control here, and I was fine and strong, and I could handle this, and I just broke down and cried. So you never know when it's going to hit you. But thankfully, these were friends, and they were very supportive and kind when that happened.
There's one last thing I wanted to share before is how people treat you as a cancer survivor. The story is, for me, it was like 4 or 5 months after my recovery was proceeding well. The family gathered to help a relative move in the Bay Area. And I was feeling good and whatever, and I wanted to help out. But when we got there, my cousins and relatives said, Titus, you just had cancer. You shouldn't be here helping us out. And that kind of hurt my feelings, because I felt that I was working so hard to recover, yet somehow the friends and relatives kind of put me in a little box saying, you know, don't ask Titus because he's sick. And in some ways, it took away a little bit of my dignity. And so we talked about this, and I don't know how people feel this about going forward, but you know, people are going to look at you differently, and just be prepared for it and strong enough to realize that they may not understand what you're going through and how committed you are to getting well. To them, it's you had cancer, and therefore we should kind of, you know, put you on the side. But for me, it felt a little bit hurt my feelings, and I'm over it now. But for those of you who might have a serious illness but working hard to get over it, realize that folks may not totally understand where you're coming from, and may say things that might hurt your feelings. But it's just something that I thought about the other day, and want to share with people here, because you might have that same feeling as I did.
You know, when Titus told me that, my first reaction was, Titus, they were being nice to you. They care about you, and they didn't want you to overwork yourself. And yet, as Titus explained more about that, it gets back to that whole thing about listening. You know, he's the one who knows best what he is able to do and not do. And so we need to listen to him. And if he says, I want to help, you know, then let him help. But we were not listening well. So sometimes we come from the best of intentions, but we have to really listen carefully to what the person is saying and let them make the decision.
Be empathetic, yeah.
Brian or Esther, do you have any other things that you wanted to share about how your family interacted with you?
My family took it very calmly, because I told them very calmly that I had a suspicious lesion on my right breast, and I told them, don't worry about it until the biopsy comes. And when it was negative, they were fine, because I was not excitable. I just took it very calmly. I have breast cancer, and I'm going to beat this thing. They did a lumpectomy, and I was just fine after that. And they said, Mom, I can't believe it. But I said, I'm just going to go through with my life, do what I was doing before this cancer came. And I'm hoping that next mammogram will be negative again, and that'll be 2024. And like I said before, I recommend self-breast examination regularly, and have a regularly have a mammogram, and of course, have a good rapport with your physician, and appreciate life, enjoy life while you have it.
Brian, do you have any other comments?
Yeah, in terms of reaction from my family, my wife took it as a matter of fact. Maybe it's because of the long journey I had with, you know, annual exams, annual tests, and it's like, well, no change, until you meet this new young urologist who's more enthusiastic and who's more assertive. But he pushed it, and you know, it was worth that experience. Just want to piggyback on Donna's comment about support. You know, ladies or gentlemen, if your spouse has a diagnosis of cancer, a very important part of support is that you attend the appointments with your urologist or with your whoever your oncologist is, to sit in, and they'll let you in. They just won't let you in the operation room. But you know, assert yourself and join your spouse in attending those appointments, because the cancer victim doesn't have all the questions, so neither will the spouse. But together, you're a team, and you'll be a team before, during, and post-op. So it's just physical support, but it's also the emotional support of finding out as much as possible what the consequences are, what the probable after effects are, and so that together you both will be more prepared for the post-op experience. And my wife was a godsend, because there's things you can do, but it's so much easier to deal with the post-op if you have someone assisting you. Something as basic as emptying the catheter bag.
Going to Costco to buy pads.
So, yeah, thank you.
Both prostate and breast cancer are the most common types of cancers diagnosed in men and women in 2023. Approximately 280,000 new cases of both breast and prostate cancer are diagnosed. Now, that sounds like bad news, but the good news is if they're detected early, they only have about a 10% death rate when picked up early. If they're picked up at a later stage for both of those type of cancers, the prognosis is very poor. If it's far advanced or spread to other parts of the body, both types of cancers have much higher mortality. But I think the bottom line of what we're trying to share with you today is that, as Esther said, the self-examinations are so important. Esther being a nurse, she knows what she's looking for, but a lot of persons don't know exactly what, except for feeling for a lump, but any other changes, discoloration, change of the nipple, any discharge from the nipple, so forth, are things that women can do to detect a new change in their breasts. So I think Esther has shared with us how important this all is, as well as the every year or every 2-year mammography, depending upon how high of a risk you are. So I failed to ask the viewers to send questions via Zoom chat, and I don't know if we're too late for that, but we have a few in our audience today, and if we have any in our audience that have questions that you'd like to ask one of the participants, please, we welcome you. Yes.
I just wanted to ask, sounds like for you, Brian, a new doctor made a difference. Sort of makes me kind of paranoid about if you go to the same doctor for a long period of time, but how about second opinions? Is it something, when the doctor tells you something as simple as, oh, you have prostate cancer, does that mean you should run and get a second opinion or not?
Yeah, I'd like to answer that question. I had the benefit of a second and third opinion, particularly regarding the surgery. They recommended a more radical surgery involving the bladder, which they estimate would be a 5 to 6 hour surgery. But I got a referral, and the whole group of urologists and the people they consult with had the consensus on a course of treatment. But the third doctor I had consulted with realized, this was all in Roseville, and I live in the Pocket area. So the third urologist realized, you live in the south part of Sacramento. Would you like a referral to a urologist that I know in South Sacramento, Kaiser? I said, certainly. 10-mile drive beats a 60-mile round trip. So that urologist, my current urologist, had a different opinion about the course of treatment. So he said, we can always drop back and punt, even in the middle of surgery, if I find that the Roseville urologists feel like we should go that route. So we went with his recommendation. So that was the fourth consultation I had. So that was my course of treatment. Yeah, it's always beneficial to get at least a second opinion.
Speaking as a physician, I welcome second opinions. I often, if I can see that there's concern by my patient, I would ask them, if they know someone, then I welcome a second opinion to see if they also concur with what I'm advising. But a lot of times patients feel like, this doctor has had this amount of training and so forth. He's done many surgeries. He should know. But if you feel uncomfortable as a patient with what's being advised, either regarding surgery or other modalities, radiation or chemotherapy, and it's difficult sometimes, because sometimes your primary doctor may not want to refer you to anyone because they don't know of anyone in the area or that may be suitable. But if you have a friend that is in the medical field, or a nurse, and nurses are very good for referring you to a good doctor, because nurses really know doctors in the operating room and in the hospitals. They know which doctors have had good results, which doctors you might not want to use. So second opinions are often very helpful, and they may give you a whole different opinion. And it all depends on where the doctor was trained to. If the doctor was trained in a certain direction, then that's what they want to do. But it doesn't hurt to find someone that can give you a more guidance as to your options. Are there any other questions from the group we have here? Okay, well, yes, we do. We have a question.
Esther, you were able to reassure your family that you would be fine, and you're a clinically astute person, so they believed you. Were you able to talk to your circle of friends about it freely? And if you were, yes, Esther, yeah.
I did talk to my friends about it, and I told them, don't worry about it. I'm able to handle it, so it's going to be fine. And so that's the end of it. But after I had my lumpectomy, about a week or 2 weeks after, my husband was diagnosed with colon cancer. His symptom was the bathroom, the toilet was just filled with blood. And then I called the office, the doctor's office, and she said, well, see if she'll do it again. And I said, I don't care, I'm calling 911. So I called 911, took him to Sutter Hospital. They did the diagnosis, they did a colonoscopy, and they found that he had a cancer of the colon, and he had a PET scan, and it showed that it spread to his liver and his lung. So he was terminal. And the doctor said, okay, do you want surgery? And he said, I don't want chemo, I don't want radiation, I just want to be peacefully gone. So he said he had a good life, his family is good, my wife is good, and we're gonna just enjoy it while we can. And so he passed. The doctor gave him 3 to 5 months, and he lasted for 11 months. He wanted to be at home, he didn't want to go anywhere else at home, and that's what happened. He died at home, peacefully.
One more question, yes?
This question is for Titus and Donna. I really connected with your story about not communicating things with your kids or wanting to protect your kids. So from the opposite perspective, what would you recommend for kids that want to have more open communication with their parents and would like to let their parents know that they would like to be informed about all of the things going on, no matter how hectic their lives are or how busy they are?
Yeah, I think it's a matter of giving them the choice, giving them the opportunity to voice their opinions of what they want from this experience, from how they are perceiving things, and that we should make decisions that include them. So I think if we were to do it over again, I would call one of our family meetings and just be very honest and open about what's going on, and then decide as a group just where they want to be involved in the process, whether they want to be at any of the doctor appointments, or whether we would meet after a doctor's appointment and give them the information. But I think the whole thing is not to keep them completely out of the picture and so-called shielded from the trauma of what we're going through. I think they sense that something's probably off or something is going on, and then not to know, and then later to find out and to realize that they were not involved in any of this. I think that could be very hurtful in a sense that they want to be involved and to be part of the support system.
And I would add that I learned from my prostate cancer experience that in the value of being transparent with them, and that presumably they love me enough to also respect me. And the reality is, I'm having a colonoscopy done on Friday, and I will explain to them, or I told them about it, but I'll explain to them, why I'm doing it, and it's part of early detection, and it's the right thing for me to do insofar as avoiding a more serious cancer going in the future. But to reassure them that, grandma had cancer, she battled through it. I had prostate cancer by following the right procedures, listening to my doctor, and I got through it. And so this is the right thing to do. And I will let them know how it goes and let them know the results. And let them know that if they have any questions, just ask me. But I don't want there to be any surprises with regard to whatever outcome happens. I also wanted to mention on early detection. I never had any symptoms of prostate cancer. I mean, I felt fine. I was exercising. My bladder control was fine. So it was only because of the PSA test that I knew that I had prostate cancer and that I needed to get it treated. But if I hadn't done the PSA test, it would have gotten a lot worse probably. So that's, I think, one reason why it's important to consider early detection, because often there are no other symptoms of your cancer. So that's why it's important to do it as well.
And Danny, I think there's one more question.
I just want to speak to that. I think that's a great question coming from that perspective. We dealt with that in our family. My husband's parents hid stuff from him, and they found out and they said, don't do that. We want to be informed. We love you. We want to pray for you. We want to support you all the way. And so we had that family meeting, and we said, we're going to be transparent, and you can expect that from us. And when we go to the doctor, if we find out something that's not good news, you're going to know. And they told us, though, that they wanted to know. So I think if you tell your family, please tell us. And, of course, some people are much more private. And then you're going to have to maybe push a little and say, I know you're private. I respect that. And I'm your daughter. I want to know. And I think you can have that kind of honest dialogue. And hopefully they'll be able to say, okay. But anyway, it's a wonderful question to say. Have the conversation ahead of time before you go to the doctor and find out something that you're going to deal with. And if so, family meeting, however, do it ahead. And that's what we did in our family. And so we laid down the ground rules, and that's what we're following. And things have come up that they needed to know. And so we've been, it's not easy, and it's scary. It's scary, it's shocking, but we're together in it. And that makes all the difference. Thank you.
Okay, Brian.
Oh, thank you, John. So I think we're heading toward a close. I want to share one additional comment. We talked a lot about detection, particularly early detection. We've talked about the operation aspect, but post-recovery, besides having that shared family support, it's about communications. All of us are different. Some of us like to share information. Others are much more private. I believe that part of the whole regimen of therapy post-surgery is communications to the extent you are comfortable with. Shortly after I retired, 16 years ago, at church, a person whom I supervised, 10 years older than me, came up to me after service and said, Brian, I just want to let you know I have prostate cancer. And it just slapped me on the side of my head. It's like, whoa, well, thank you for sharing. Another year later, another person who I work closely with, 10 years younger than me, came up to me and said, Brian, I just want to let you know I had prostate cancer. I'm okay now. So that kind of ignited a thought in me that part of my recovery is to, share this experience to people that you're comfortable talking with, that share this experience. And interestingly enough, they'll come right back to me and says, I've had cancer, or I've had something else. But it opens up that dialogue and the opportunity to talk about it. Kind of brings back memories, but it's also therapeutic. I found it therapeutic. So, it's up to everyone's choice. But I found communications, it's helpful, and you'll find there's many more cancer survivors out there.
Well, we want to thank all of our participants today for your very honest and candid comments and sharing all of these. Some of these are very private to us, and maybe some of our own families may not have heard some of these stories from us, but I'm glad that you've taken this time to share these stories, and we're looking forward to further presentations, and also we thank ACC for giving us the opportunity to have these honest discussions. So we're looking forward to seeing you again, and thank you for watching today.